Today we'll be talking about Pompe disease. Pompe is due to deficiency of an enzyme called acid alpha-glucosidase, or GAA for short. So GAA is a lysosomal enzyme that breaks down glycogen. So what is glycogen? It's a storage molecule for glucose. So it essentially helps us store glucose when we can't take it in via the diet. And so if you have a deficiency of acid alpha-glucosidase, that's going to result in increased lysosomal glycogen within skeletal and cardiac muscle. So very important, lysosomal glycogen. Most of the glycogen in our body is broken down in the cytosol. So if you ever see lysosomal glycogen, that's a really big clue that they're asking you about Pompe disease. And then the involvement of both the skeletal and the cardiac muscle, very important. This typically does not affect the liver, the spleen, the brain, or other organs. It's really limited to the muscle. Okay. So what's the mechanism behind this accumulation of lysosomal glycogen? Well, we can see here on the left, we start off with glycogen, most of which, as we know, is present in the cytosol and degraded in the cytosol. However, a small amount of glycogen enters the lysosome and undergoes degradation there. And when that happens, glycogen gets broken down into successively smaller sugar components. So a oligosaccharide, it just means a short sugar chain. And then eventually the GAA enzyme is able to act on those oligosaccharides to produce glucose. So in Pompe disease, you don't have this GAA enzyme. So what's going to happen is you'll have increased oligosaccharides as well as increased glycogen, and these are in the lysosome, right? So increased lysosomal glycogen, that's where this comes from. In addition, the accumulation of these oligosaccharides can be detected in the urine as something called hex 4. These are 4 units of glucose sort of strung together, and it's a biomarker for Pompe as well as some other glycogen storage diseases. So this is how Pompe looks like at a molecular or cellular level. Okay, so clinically there are 2 types of Pompe. There's early onset and late onset. The early onset form of Pompe usually presents in the first few months of life, and it presents with hypotonia, feeding difficulties, and respiratory difficulties. These are due to the skeletal muscle weakness, right? You need your diaphragm to breathe. You need your muscles in your arms and legs to move. And you need the muscles in your mouth to feed. So that's where those symptoms come from. It also affects the muscles of the heart, and that's what causes the hypertrophic cardiomyopathy that we often see in Pompe disease. That's early onset. Now, the second type of Pompe is called late-onset Pompe, and this presents typically a little bit later on in life with slowly progressive skeletal muscle involvement without cardiac involvement. So there's going to be only skeletal muscle, but not the heart in late-onset Pompe disease. So the diagnosis of Pompe disease is often made initially on newborn screening, or NBS. This is initially screened for using an enzyme activity assay showing decreased acid alpha-glucosidase levels. And this typically is followed up by confirmatory sequencing of the GAA gene, which encodes this enzyme. I do just want to point out why the acid, why do they mention this in the name? Well, the lysosome is a very acidic place. And so that's why the acid alpha-glucosidase has the word acid at the beginning. It's because that's where it happens to work, is in an acidic environment. Urine hex 4, we've already looked at this. We know it's an oligosaccharide composed of short chains of 4 glucose monomers strung together. And then other labs, so the serum CK, creatine kinase, as well as increased AST and ALT can be identified oftentimes in patients with Pompe disease, and this reflects the increased muscle breakdown that you see in these patients. And then finally, if you were to do an EKG on a patient with early onset Pompe, you'd expect to see hypertrophic cardiomyopathy. The management of Pompe disease is with enzyme replacement therapy. So the idea here is that you are deficient in acid alpha-glucosidase with Pompe disease, and so you can essentially give an engineered form of that enzyme back intravenously. And for early onset Pompe disease, it's very important to start treatment right away. So as soon as you can, and this is because it can improve clinical outcomes, improve survival long term. And just to know, untreated early onset Pompe disease often results in death within a year. So this is why it is very important to start as soon as possible, as soon as you find this result on newborn screening, and as soon as you confirm it, you want to go ahead and start the enzyme replacement therapy for these patients. If you found this video useful, please like, subscribe, and share. You can also subscribe to my monthly newsletter with board-style questions for exams. And you can also buy me a coffee to show your support for the channel. Thank you.